Hello everybody. Today I'm gonna talk about Rose River fever. I'm going to talk about the prevention, causes, symptoms, treatment and diagnosis. My name is Hassan Al Ali. The Rose River virus is a mosquito transmitted alpha virus that is endemic in Australia and Papua New Guinea. It caused a large epidemic in 1979 and 1980 involving Fiji, Samoa, and the Cook Islands. Rose River virus causes the most common arboviral disease in Australia. Mosquitoes are medically important because they transmit many diseases such as the dengue fever, yellow fever, and Rose River fever, which is previously termed as the epidemic polyarthritis. Rose River disease is the most commonly transmitted mosquito-borne viral disease to humans in Australia. The number of cases has averaged over 5,000 annually during 1991 to 1997. The virus appears to be endemic in most rural areas, and there has been an increasing incidence near major cities. For most of Australia, peak incidence of the disease is through the summer and autumn months, particularly from January through to March, when mosquito vectors are most abundant. Here is a map that shows the geographical distribution of the Rose River virus throughout Australia. As you can see, the dark blue color shows high percentages of infestation of the Rose River virus, whereas the light blue or white color shows a very low infestation of the Rose River virus. The causative agent of the virus belongs to the genus Alphavirus, which is part of the family Togaviridae. The alphaviruses are a group of small enveloped single-stranded positive sense RNA viruses. Many people can be infected with the Rose River virus when they are bitten by a mosquito carrying the virus. It is suspected that mosquitoes pick up the virus from kangaroos and possibly other animals or wild rodents, which can act as a natural host for the virus. Diseases that are spread by insects are known as vector-borne diseases. Now I'm going to talk about what transmits the disease. There are three types of mosquitoes that transmit the disease: the Culex annulorotis, the Aedes visualix, and the Aedes notocriptus. The Culex annulorotis and the Aedes visualix are the two main types of mosquitoes that transmit the disease at a high level, whereas the Aedes notocriptotis transmits the disease at a very low level and probability. The Culex annulorotis belongs to the family Clocidia and the genus Culex. The Aedes visualix also belongs to the family Clocidia and the genus Aedes. The difference between the Culex and the Aedes is that the Culex annulorotis, especially the females, have dark scaled proboscis, whereas the Aedes visualix have pale scaling proboscis. Now I'm going to talk about the life cycle and how the mosquito transmits the disease. The Rose River virus usually lives in native mammals such as kangaroos and wallabies, but can also affect rodents, bats, and horses. These animals act as natural reservoirs for the virus, and when a female mosquito bites an infected animal, it picks up some of the virus. The virus enters the human bloodstream via the saliva of an infected mosquito. It then reproduces itself in blood cells and builds up in the muscles, joints, and skin, resulting in the symptoms of infection, which I'm going to talk about later. The Rose River virus cannot be passed directly from person to person. To diagnose a person with Rose River fever, a simple blood test is a way to confirm a case of Rose River fever. Several types of blood tests may be used to examine antibody levels in the blood. Tests may either look for simply elevated antibodies, which indicate some sort of infection, or specific antibodies to the virus. However, if a patient has high CRP, which is responsible for inflammation, anemia, or reduction in joint movement, then the diagnosis of Rose River fever should be considered. While examining a person with Rose River virus, symptoms usually come on between 5 and 14 days after being bitten by an infected mosquito and disappears within 6 weeks. Infection with Rose River virus is most commonly associated with fever, rash, and joint pains. Swelling of joints may also occur, especially in the fingers, wrists, and feet. Rose River fever is also sometimes known as epidemic polyarthritis. General symptoms such as nausea, headaches, backaches, and muscle aches are also common. Lethargy and fatigue are often devastating with some people which are unable to carry out minor activities or even get out of bed. However, 10% of people have ongoing joint pains, depression, and fatigue for many months. In some cases, particularly in children, infection with Rose River virus may cause no symptoms at all. If a person is diagnosed with Rose River virus via a blood test, unfortunately there is no vaccine to prevent Rose River infection, and there is no medical cure for this disease. Medical treatment is aimed to ease joint pain and swelling, and minimize fatigue and lethargy. For some people, simple painkillers like aspirin or paracetamol are sufficient. Others will require stronger medication to ease the inflammation. Emotional stress, physical fatigue, and alcohol may cause symptoms to worsen or to last longer. Finally, protecting yourself and your family from mosquito bites is a very important factor in preventing diseases. You can do this by avoiding non-mosquito infested areas, especially at dawn and dusk when mosquitoes are most active, screening windows and doors in your home, and making sure these don't have holes in them, using screen tents when camping or sleeping under a mosquito net. If there are mosquitoes around at bedtime, use insecticide to kill them before you go to sleep. If you are outdoors, use a personal insect repellent and cover up with long sleeves, shirts, and trousers. Loose-fitting clothing is recommended as mosquitoes can bite through fabric. It also pays to check around the house for areas of stagnant water where mosquitoes love to breed. Uncovered ponds and tanks or even undrained pot plants, blocked gutters, and buckets around the garden can be great areas for mosquito larvae. If it's possible, get rid of the water or use insecticide around the area to kill the mosquitoes. Thank you for listening. If you are interested, there are a few sources that you can read more about this topic. Thank you.